Oregon Secretary of State office is calling on the Oregon Health Authority to take urgent action in the state's response to what they're calling a behavioral health crisis. In an audit of Oregon's behavioral health system released by the Audits Division today, it says there are significant data gaps in Oregon's health systems impacting the ability to assess and respond to behavioral health crisis. Like I say, the gaps have existed for 23 years. Auditors also say that funding for the state's behavioral health crisis response system is inadequate. Progress is stunted by a lack of long-term planning, and legal and jurisdictional challenges limit behavioral health interventions and for Oregon's tribal nations.
What it looks like really clearly is the right hand is not always aware of what the left hand is doing. And so one of the main takeaways from this audit, I think, is a need for better coordination and communication so we can make sure that more Oregonians are getting the help that they need.
The Secretary of State's office gave the OHA 12 recommendations in regards to these problems that were found in data collection, like funding gaps, strategic planning, and legal barriers, and says the OHA agrees with these recommendations. In response to the audit, the Oregon Health Authority tells NBC5 in part, quote, the audit identified gaps in the Oregon's behavioral health system that OHA is actively working to address, has some recently made progress on, and will continue advancing as outlined in the governor's recommended budget. Gaps in Oregon's behavioral health care system that the audit recognized will only be solved with sufficient workforce investments outlined in the GRB, end quote. For the full statement and the full audit, you can visit our website, KOBI.com.